How are you, my dear students? Welcome to another chapter, which is chapter 8. In this chapter, we are going to study about sexual transmissions infections, sexual transmission diseases, HIV and AIDS.
So now let us start with the sexual transmitted infections and sexual transmitted diseases. So sexual transmission infection and sexual transmission diseases are transmitted through unprotected sexual intercourse with an infected person. Not all sexual transmission infections turn to sexual transmission diseases. The following are some common sexual transmission infections and sexual transmission diseases and their sources, symptoms, effects, and how to prevent and how to control them. So now, my dear students, the following are the summary of some common sexual transmission infections and sexual transmission diseases and their causes, symptoms, effects, and how to prevent or control them. So let's now see the human immunodeficiency virus, which is HIV, and acquired immunodeficiency syndrome, which is AIDS. By starting with HIV, the virus attacks the body's immune system, weakening it and makes it more susceptible to infections and some cancers.
It's important to realize that infection with the HIV virus does not necessarily result in AIDS. Also, HIV attacks a type of white blood cells which is necessary for immunity. After being affected with HIV, a person can remain asymptomatic for years.
The multiplication of HIV in the blood leads to massive destruction of helper T cells. These weaknesses end the immune system and the person develops opportunistic diseases. Low immunity makes a person prone to diseases that would normally be fought off by the immune system. Examples of opportunistic diseases are pneumonia, diarrhea, TB, and skin rashes. Antiretroviral drugs, ARVs, can slow the progress of AIDS but cannot cure it. TB, as an opportunistic disease, is a leading cause of death among HIV victims when untreated. Above all, so now let us see the transmission of HIV. By starting with transmission number 1, having unprotected sexual intercourse with an infected partner. Transmission number 2, sharing needles or syringes with someone who has HIV. Infection number 3, an infected mother from mother to child during pregnancy, childbirth, or breastfeeding. Number 4, sharing toothbrushes, shaving braids, or nail cutter with an infected person. And number 5, it transmitted through blood transfusion with contaminated blood. One thing to remember is HIV is not spread by casual contact such as shaking hands, hugging, or touching unless both people have open wounds. So now we are going to see the signs and symptoms of HIV and AIDS. These several symptoms of HIV, not everyone with HIV shows the same symptoms. It depends on person's immunity and the stage of diseases. Some symptoms caused by HIV can be caused by other diseases such as influenza and tuberculosis. Therefore, the only way to tell whether the person has HIV infection or not is through testing. So there are 4 stages of HIV and AIDS. Number 1, primal stage or widow stage. This stage is accompanied by flu-like illnesses. The HIV test is negative and the person looks healthy. Number 2 is asymptomatic stage. At this stage, a person looks healthy and does not show symptoms, yet the HIV test will show the positive results. Number 3, symptomatic stage. This stage characterized by several damage to the immune system. At this stage, some symptoms of AIDS are invisible. Number 4, full-blown AIDS. On this stage, one gets various opportunistic affections and diseases. A person becomes very ill and weak. So now the following are the signs and symptoms of AIDS. A. Tremors, loss of weight. B. Present fever. C. Chest pain. D. Diarrhea for no observed cause. E. Coughing for more than 1 month. F. Shortness of breath getting worse over several weeks. G. Itchy skin rashes. H. Thrusts in the mouth or throat. I. Loss of air. So now let us see the effects of HIV and AIDS. Number 1, reduce labor and production force. Number 2, increasing numbers of orphans, thus adding a burden to relatives and the society. Number 3, stress, stigma and discrimination to some victims of HIV and AIDS. Number 4, high cost of treatment and purchases on drugs incurred by the government. And number 5, it reduced life expectancy. The following are the prevention and control measures of HIV. A. Use the ABC method to prevent the disease. A. Abstain from sex. B. Be faithful to your only partner. And C. Use condom. So this means that you are advised to abstain completely from sexual intercourse. If you can't, then have one faithful partner, and if this seems to be difficult, then use condom. B. Avoid sharing sharp tools with the infected individuals. C. Blood transfusion should be done prior to HIV screening. D. Pregnant mothers should attend clinics so that they can get treatment that will prevent HIV transmission from the mother to the baby. E. Avoid all risk bad behaviors, situations, and practices that may enhance HIV transmission. For instance, the risk behaviors are drug abuse, prostitution, rape, anal sex, oral sex, alcoholism, unsafe sex, roaming in bars.
So, risky behaviors can be avoided by A. Practicing safe sex. B. Applying non-representative sex, example, kissing, hugging, and etc. C. Delaying technique. Example, I'm required at home just now. Let us meet tomorrow. D. Engaging in sports and games which distract one's mind from concentrating to sex. D. Showing a sense of dislike to express the way you are by wearing t-shirts, capes with various messages. Examples of messages are Proactive safe sex, mimi nimepima, wewe je? AIDS skills, say no to sex, and etc.